to say what an honor and pleasure it is to welcome all of you to remember and celebrate the life of a truly great man, Dr. Thomas Borden. It's truly my honor to be able to speak about a person that to me was an educator, mentor, and friend. I can stand here today and honestly say that I owe my career to this man. He gave me an opportunity and I will always be grateful to him. He touched so many lives through his long career here at the University of New Mexico. He was chief of the Division of Urology for over 30 years. He practiced pediatric urology. He educated over 60 residents that practice all over the United States. He held numerous positions at the institution, was truly a legend, given his many years of service to the University of New Mexico. He accomplished many things throughout his career, but his greatest accomplishment was raising two great kids and being a friend to those who knew him. He also cared for and provided a service to numerous children throughout the state. These children would otherwise have had to travel outside the state to get his expertise. I first met Dr. Borden in 1995. I was an intern rotating in urology at that time. I was not a urology resident. I was in a transition year and wasn't really sure where my future would take me. One of my classmates decided to leave the urology residency program and left an open spot. The residents on the rotation at the time encouraged me to apply, and not knowing how competitive it was and having nothing to lose, I went ahead and applied for the position. I remember being told about interviewing with Dr. Borden, which is the first time I would meet him. The residents senior to me told me that Dr. Borden would oftentimes pause in conversation. And this didn't mean he was finished with what he was saying, it just meant that he was taking a pause. And you shouldn't interrupt him. So I remember this when I went to the interview, and I didn't interrupt him. Through the years I learned this was not an eccentric habit. It was the fact that he would think through exactly what he wanted to say. He would not waste words or say something just to say it. He would articulate exactly what he meant efficiently, having no room for doubt. When I rotated on pediatric urology with Dr. Borden, I got a crash course on how to be prepared for the OR and clinic prior to my start in the rotation from the resident before me. The rotation one was a fairly regimented routine, and I learned that Dr. Borden was a man of routine. Dr. Borden would come to the OR and operate on these tiny kids. As a resident, I didn't realize the pressure he must have been under. Every parent wants a perfect outcome for their child. I would get really nervous, seeing as how Dr. Borden was the division chief and the program director, and I'd start shaking in the OR. Of course, he'd notice this, and he would say, "Davis, you're shaking like a dog crapping bones." I often wondered what Dr. Borden fed his dogs. And I wondered what kind of shake those dogs would have. If it was a bad shake or a slight shake. Clinic was the same. He would arrive and would always be dressed in a nice suit with nice suspenders, immaculately dressed. He loved clothes, and sometimes he would let out how he considered going into the closing business someday. I learned to compliment him on his shoes, and this always made clinic go better. Or just having a cold Coke on hand would also make clinic go more smoothly. At 5 p.m., like clockwork, I'd get called into his office and go over this operative schedule for the next week. And there'd always be sticky notes on his desk. Sticky notes all over the place. He had lists of lists. He was always super organized and prided himself as a division chief of running his division financially in the black. I soon graduated residency and I went on to fellowship. I was recruited back to UNM in 2001 and have been there ever since. Dr. Borden recruited me. This was the second opportunity he gave me. Prior to my arrival at UNM, Dr. Borden had already hired some great faculty who trained me and are now close friends. We all have really fond memories of Dr. Borden, and you'll hear some of those today. I didn't know much about his private life. I did know he would go someplace super cold and fish for muskie. I can't imagine having the huge responsibility of running a residency, being a division chief, and raising 2 children, but he managed to be successful at all of them. As time went by, I got to know Dr. Borden as a friend. Sometimes passing me in the hall, he would say, "Dr. Davis, you still work here?" I would call him for advice about patients, the institution, and later about how to run a division. He kept seeing patients even after retirement, and we would walk out of the building at the end of the day and talk about the state of medicine and the Health Sciences Center. He continued to have his hand on the pulse of the division even in retirement. He would often call Bernadette and get updates. He would always tell me that he was glad he left when he did. I enjoyed laughing with him about some of the ridiculous things we have to do in medicine now. He got to practice medicine when you took care of patients and worried about patients. It's now an era where you take care of patients, worry about patients, and worry about the right box to check in the electronic medical record. I wanted to share my story because I'm only one of countless lives Dr. Borden impacted during his lifetime. Obviously, there are so many people he influenced. I'll always remember him and be grateful for the opportunity he gave me in 1995. I'd just like to thank the family for allowing me to say a few words today and giving us the opportunity to remember and honor him. I'd like to thank Bernadette for putting together this program, and I will miss him greatly. I'd like to read a few words now from Dr. Fry, who was the prior department chair here at the University of New Mexico. This is an email to Dr. Russell. It is with great sadness that I have learned of the passing of Tom Borden. Unfortunately, I'm out of the country and cannot attend the memorial service. Tom was skilled at caring for his pediatric patients. He was committed to the education of his urology residents. His contribution to the University of New Mexico School of Medicine covered the better part of 4 decades. He made surgery at UNM a better place. Tom was always worth consulting about problems in the department and always took a position that was in the best interest of all the faculty. He was slow to anger, thoughtful in his response to difficult situations, and provided much needed support to me personally during the turbulent years. He will be missed, but he will be remembered. That's from Dr. Fry. And now I think Dr. Smith can come up and say a few words.
I thank everybody for being here, and I think you're going to hear a lot of redundancy today because I think we all have similar, very high opinions about Dr. Borden. So I'm really honored to be here today to celebrate his life. He's a man who, just like with Dr. Davis, was mentor, friend, colleague in urology for almost 30 years. There's things in life that happen that sometimes you believe are fated. And I honestly believe that my coming to the University of New Mexico was fated. And I'll explain that in a minute. I could spend a lot of time talking about Dr. Borden's integrity and honesty or his skill as a physician and surgeon. But I decided I'm just going to tell some stories. My path to Dr. Borden was a little different than usual. I started out, I was going to be a heart surgeon, and I knew it deep down to my core. I spent a summer doing surgical research with Dr. DeBakey, and I did 3 more summers of heart research. I met my wife working as a nurse's aide in the thoracic ICU at Parkland, and I was gung-ho. And so I entered my residency sure about my choice, but near the end of my internship year, I stumbled onto this thing called urology, and I suddenly realized that maybe I'd made a bad choice, that maybe this was the right direction. So I called my dad, and I told him I was thinking about making a change. It was kind of midstream, I wasn't in the match or anything. And lo and behold, I could have been more than 2 days later, I get this phone call from a urologist in Clovis, New Mexico, Dr. Alan Haynes. And Dr. Haynes was a graduate of the program, and he spent time on the phone talking to me about how wonderful the program, or how wonderful urology was, what a great career it was. And he kept talking about how wonderful the training program in New Mexico was under the leadership of this guy named Dr. Tom Borden. So I still wasn't quite sure. I decided to go and investigate and figure out what it was the urologist did, because I really didn't know. I just seen a very narrow area of that specialty. So I went to the library and I started looking for books, and lo and behold, the first book that I see on the shelf is a book called Genitourinary Cancer Surgery by David Crawford and Dr. Tom Borden, which just shocked me. I pulled it out, and I still to this day believe it's one of the best surgical atlases ever written. There were 3 openings: New Mexico, Wisconsin, Illinois. I submitted my applications, and it was literally that night I received a phone call from one of my really good friends in chemical engineering, Alan McCulloch, who's right here in the front seat. And I didn't even know he was in medical school. And I said, what are you going to do? He said, well, I'm going to study urology. I said, oh, really, where? He said, well, at New Mexico. He said, there's a guy, Tom Borden, here. And he said he's really something. And he said, he's he would be great to train with. So I wound up coming to New Mexico. And for then, about the next 30 years, Dr. Borden and I were kind of joined at the hip in one way or another. For us residents, he became the old man almost as soon as I entered the program. He was referred to as the old man, I think, because of the way he would look at you with his glasses like this. And over the years, we shared a lot of stories. He taught me the art and science of urology. He had a dry wit that especially came out during his teaching in the operating room. I remember one day we were doing a particularly difficult case in the operating room, and we were wading through scar tissue trying to find something, and we suddenly found what we were looking for, and he says to me, well, Tony, even a blind hog finds an acorn once in a while. I remember another occasion when we were getting ready to try to close the wound, and we were debating whether or not it looked good enough to close. Maybe there was a little bleeding or something. And he came in and took a look, and he says, well, Tony, that wound looks drier than a bone fart in the desert. He emphasized technique above all things in the operating room, and exquisite technique. And he taught me to care for patients in ways in the clinic that I had not been taught before. Over the years, we shared all kinds of ups and downs together. We attended a fair number of urology section meetings, so we would travel. I remember one trip to Mexico, we landed, and you saw it there, a 400-pound blue marlin. The 2 of us wrestled it in over about 4 or 5 hours. I listened to his tales about black powder, rifle hunting in southern New Mexico. He hunt elk down by reserve. All of the residents will recall the feeling of walking into his office and to be stared down by a musky fish with a big open mouth with its fangs hanging out that he kept near the front of his desk, right alongside of the hand grenade with a sign that says something like, complaints, please pull pin. I also heard tales about his training at the University of Chicago, and a lot of people might know this, but some might not. He trained under Charles Huggins, which was one of 2 Nobel Prize winners, prize-winning urologists. He always kept a picture of Dr. Huggins in his office, and woe be it for the unsuspecting intern that came in there and did not recognize the man in the picture. So you always want to make sure you knew who that was before you went in there. There was one tale that he told me that stood out, and I'll tell you that one. The day that Dr. Huggins won the Nobel Prize, he and Dr. Borden were out at lunch. And Dr. Huggins got a phone call, and in those days he had to go answer the phone, and he didn't have a cell, so he went to answer the phone at a regular phone. And a few minutes later, he walked back to the table. He grabbed Tom's paper napkin, took a pen, scribbled something on it, folded it up, put it back on the table, and walked out. And Tom said he had absolutely no idea what was going on. He picked the napkin up and opened it up and it just said, I won that prize. And then so he still didn't know what it was about. He went back to the campus and everybody was celebrating because he won the Nobel Prize. So that was an interesting story. He cared for thousands of children at the University of New Mexico. He did it with skill, compassion, empathy, and we all learned from that. We watched residents during those years come and go and move off and do wonderful and extraordinary things. We have residents that are doing things that are just truly amazing. I think when he retired, one of the things that I was able to accomplish and that I am proud of is we were able to fully endow the Thomas Borden Professorship in Pediatric Urology, and that chair is currently held by one of his former residents, Dr. Jason Wilson, who is, by the way, a surgeon doing extraordinary things. Dr. Borden continued to see patients until shortly before he became ill about a year ago. Just like in a family, my relationship with him, it had ups and downs, but it always returned to friendship. I have, unfortunately lately, attended a lot of funerals for family and good friends. And I've come to understand one thing. In 1 Corinthians, we're told that there are three things that endure: faith, hope, and love. But the greatest of those things is love. And I've come to understand that that is absolutely true. In the end, what I realize is that after we die, all that lingers is the amount of love we project to others. Tom Borden projected a lot of that love. And that's why a lot of people are here today. It's that love that endures, and it's all that we remember of them. All the rest fades into nothingness. So rest in peace, Tom. And I just hope you don't give them too much grief up there in heaven.
Well, thank you everybody for coming here tonight. And well, maybe I can figure out what to say. Innumerable are the ways that Tom shaped both urology at UNM and our careers and sometimes our personal life. I'd like to share some of his early history that many people might not remember or might not know, that were formulated in him in his career and his person. He grew up in Indiana, his dad being a factory worker in the rubber industry. And he talked to me about his dad a number of times, particularly how proud and how stubborn a person he was. And he told me about an experience early in his youth. As you know, Tom was an avid hunter and so was his dad. And one day, Tom showed up at the breakfast table, all geared up to go hunting when it was a school day, and didn't tell his dad about it. He recounted how his dad just reached across the table, grabbed him by the front of the shirt, and lifted him out of the chair, saying, "I think it's a good day to go hunting today." We all know how beloved his University of Chicago was, and his wonderful experiences working under Dr. Huggins. Many people don't know that Tom completed a master's in pathology during his first year of medical school, as well as completing medical school in 4 years. He did it under the auspices of Dr. Huggins as well as from Ewing. And I'd like to digress just a moment about his recollections of Dr. Huggins' experiences and Dr. Huggins himself. Huggins developed a model for prostate cancer in rats in 1941 that he used to demonstrate that prostate cancer was sensitive to androgen deprivation. Until that time, it was thought by cancer scientists that cancer cells were completely anarchist. And it was the first time anyone recognized that the host environment influenced cancer cells. In 1946, he developed a similar animal model demonstrating breast cancer sensitivity to estrogen, and founded the Cancer Institute at the University of Chicago. Under his direction and auspices, they were the first people to demonstrate estrogen receptors in breast cancer, a phenomenon that's used as first-line therapy today. And as Tony noted, in 1966, he won the Nobel Prize. Under Huggins' supervision, Tom studied the effect of estrogen therapy on atherosclerosis in rats. And the rationale for this was that that the morbidity for estrogen therapy was increased morbidity related to atherosclerotic events. So Tom's study his master's thesis was a physical-chemical study of the lipoprotein system of the normal and estrogen-treated rats in relation to atherosclerosis. And he subsequently published that in peer-reviewed journals. The next year, in 1964, he did microscopic studies of the renal papilla, examining the anatomic role of stone formation in the microtubules. And later that year, he also developed models in conjunction with some of the faculty in animal models with pyridoxine deprivation that caused calcium oxalate stone formation, as well as ethylene glycol models which stimulated oxalate stone deprivation. Soon after publishing these studies, one of his mentors advised him that it didn't look very good to be published in famous journals under the name Tommy Borden. So they motivated him to change his name to Thomas, which he did at that time. Tom told me stories about his experiences with Dr. Huggins. Once in the cystoscopy clinic, Huggins paced back and forth until the chief from Mullen left. When Mullen left, Huggins came over to Tom and says, "You have to cystoscope me today." He wouldn't tell Tom why. When Tom looked in his bladder, he stammered and stuttered and said, "Sir, I'm sorry to tell you that you have a bladder tumor." And Huggins said, "Is it over the right ureter orifice?" And Tom said, "Yeah, how did you know that?" He said, "Never mind, get me off the table." So it turned out Huggins was a proliferator. He formed lots of stones. And he had one based on symptoms that he knew was in his right ureter orifice. And then developed gross hematuria and wanted to get scoped to make sure he really didn't have a bladder tumor. And he knew the tumor was just inflammation around his orifice from the stone. And Tom again was befuddled by his great professor. During his chief residency, Tom was doing an open prostatectomy for benign disease on one of Huggins' private patients. And during the procedure, he lacerated the posterior capsule. Not sure what to do and intimidated and regretful, he called Huggins up on the phone. Huggins was in the lab, and Tom told him what happened. And Tom says, "I just heard, fix it." And then the phone slammed down. I figured I'd get some on my own. And during the graduation ceremony, Dr. Huggins gave Tom a pocket screwdriver as a graduation present. And it came along with it a list of 70 ways to use a pocket screwdriver. Well, they were having cocktails together, and Tom was drinking a martini, and Huggins reached over, grabbed the screwdriver, snared the olive, and said, 71. After graduation from residency, he was attending in the Air Force at Wright-Patterson. And amazingly enough, the two urologists there were Borden and a guy named John Redmond. Both Tom and John became two of the most well-known pediatric urologists in the country, and both were long-standing chairmen at their respective departments. And both, although their personalities were absolutely different, they were at the two extremes of society almost. They remained affectionate friends. Tom helped start the transplant program at the university in the late 60s, early 70s, with Dr. Peters, the chairman of the department and vascular surgeon, helping run the team. Peter Berggren, a urologist under Tom's supervision, being the retrieval and donor surgeon. And Tom doing a good number of the transplants, something that he never shared with me. Banowski and Borden published a paper on the early experience of renal vascular hypertension in the pediatric population. That was in 1973. In 1974, Borden published the first experience with his invention called the circle nephrostomy tube. Tom invented it and patented it, but never charged any royalties because he didn't want that cost to be passed on to the end users, the patients. Later in the 1970s, Jeff Woodside joined the program as a resident and faculty. And Woodside, Borden, and McGuire from Yale University were instrumental in studying the pathophysiology and treatment of malignant myelodysplastic patients, and subsequently published their experience with guidelines in terms of selection and management of undiversion in these patients. There were landmark experiences that affected the practice of pediatric urology. I always found Tom to be a wonderful friend and a wonderful mentor. And he always could be called upon for advice and service. One day, Tony and I were doing a transplant on a pediatric patient who was myelodysplastic. He had a colon conduit with a continent catheterizable stoma, had a bilateral nephrectomy. And he was very much growth stunted to the point where we had to do the transplant intraperitoneal. This guy was so difficult that after 2.5 or 3 hours of trying to get through his adhesions, Tony said to me, "Do you think this is possible?" And I said, "I don't know." We worked a while longer, and I realized I wasn't going to be able to accomplish exposing his retroperitoneal vessel. So I called up Tom, and Tom was literally walking out the door to go turkey hunting. He came in without any hesitation, and over the next 2 hours, Tony and I were so tired from staying up all night during the retrieval, we sat on the floor and fell asleep. And Tom and the scrub nurse did the abdominal exposure. And when he got a window about this big around the vena cava, he woke us up and said, "Sorry, I'm leaving, fellas." Here's the vena cava. And so we were able to complete the case. Tom played many roles in the university that people often didn't recognize. He was a long-standing member of the promotions committee and for the academic tenure committee. And he used these roles to shape the university and our division in many ways that most people will never know about. Additionally, excuse me just a moment. He was just a wonderful mentor to the entire residency group. And I'd like to end my discussion by saying that on Sunday, I went hiking on the Embudito Trail with my wonderful wife, Roz. Usually can keep up with her, but I was pretty tired and I think I was preoccupied. So she went on ahead, and I've hiked that trail at least 50 times since my retirement. And during my hike on Sunday, I got off trail at least 6 times. Not being able to take the memories of Dr. Borden out of my mind. He's just he was a wonderful figure in all of our lives, and we'll miss him dearly. Thank you.
I think he'd be really happy to see all of you here. He was really proud of the friendships he had. He would always take time to stop and speak to anybody that was lucky enough to be to be among the people he considered friends and colleagues. I'm really humbled to be part of his legacy. And I feel like he helped me in more ways than I'll possibly ever know. Some of that's just because I'm a slow learner. And I think some of that is also because he worked in ways that weren't always apparent to me. He had a gift with diplomacy. He would have been a gifted politician, I think, and he did participate in the politics of the university. And it seemed like he did it very skillfully to me. And to do that takes a talent that I suspect is something I'll never achieve. And to know that he was part of so many different things is truly baffling to me. He was a family man, he was a mentor, he was a colleague, and he was a friend. I met him in 1997. I too had thought I was going to do something else with my life. And I rotated on urology in San Antonio, and I liked it, and the urology residents told me that I had a knack for it. So I believed them, and I told them I might be interested in doing urology, but I was already committed to another career path. And somehow they heard there was an opening in New Mexico, and they said, "We got you an interview, you need to be on the plane and be up there by this time." So I just did it. And the only thing I remember from that interview is that I wore brown shoes with a navy blue suit. And my chief resident, who ended up being my chief resident, John White, was very quick to point that out to me. And he seemed to think that this meant I was not going to get the job. I'm glad to say that it did not prevent me from coming to work here. I remember during the close of my interview with Dr. Borden, he asked me, if I offer you the job right now, will you accept it? And I remember admiring his directness and his openness and his manner of communicating with me. And I would come to find out through many years after that his way of communicating with me would never change. He was always direct, he was always open, and he once shared with me that he tried to communicate not so he could be understood, but so that he could never be misunderstood. And if you had the opportunity or the privilege to spend much time with him, I think you understand that. And Mike alluded to his long pauses, and I think he was doing exactly that. He was gathering his thoughts so that he could not be misunderstood. Whenever I decided to do a formal fellowship, I went to him and asked, after working with him for about 5 years, I went and asked if he thought it was a good idea. And he asked me if I wanted to do it, and I said yes. And he said, "Well, it's a good idea then." He had made a special effort to get me a certificate of special competency in pediatric urology, which I'm sure was not an easy feat within the system, but he made it happen, and I probably took it for granted as something that was easy for him to do. It probably made it to one of those Post-it notes, which, if anything made it on there, it was going to get done. He could have written "Lasso the Moon," and it would have happened on his Post-it notes. So, but he told me he would support that, and he made sure I got a position. It was around the same time when I came to think of Dr. Borden as kind of a celebrity, because it turns out the first full-time pediatric urologist in North America, Dr. Lowell King, was a really close friend of Dr. Borden. And when Dr. Lowell King was thinking about retiring, Tom talked him into coming out here and spending some time with us. And what a pair to see interacting together. Mind-blowing stuff, truly. It was really, I felt like I was in the presence of greatness. And I think I was. But they both made sure I got some training in pediatric urology, and I got accepted to a fellowship. Incidentally, that was a fellowship that was available because someone left the position vacant also. But you know, about 3 months into my training in San Francisco, I realized I had all the training I would ever need already, and that I was there for a piece of paper. And it's because of Dr. Borden, you know. I think he taught me many things, and I think over the years I'll come to learn those things that he taught me that I'm not aware of yet. And like I said, I'm truly humbled and I'm truly honored to be part of the legacy that he created and will continue to live on for many, many years. Thank you.
So Tom Borden was many things to each of us. To me, he was a friend, he was a mentor to me, he was a colleague, and he was a counselor, because Tom always had his own unique take on what was happening in the world, what was happening in the department, what was happening in the school. And I think many people have commented about the pauses. You had to read between the pauses to kind of understand what was being said. Dr. Borden's 43 years of service in his medical school, I can't believe will ever be equal. Ever be equal. I came rather late to the UNM experience in my life, and I first met Tom in 2004 when I came here to be the Dean for GME. To have the opportunity to work with Tom and with Tony Smith, who at that time was the program director, on issues in urology. It was clear that Tom had established a tremendous legacy, and that the division of urology was his life, was his passion, and that he was enormously proud of the legacy that he had helped to create in terms of faculty, several of whom have spoken, and in terms of the many residents that he had helped to get trained and to graduate. The Borden Professorship will remain as an important legacy to Dr. Borden. And I'm proud that urology was able to put that together, and that Tom saw it and was able to enjoy that and recognize the love that the department, and specifically the Division of Urology, had for him. He was the conscience of the department. He was a great counsel to me, and he will be deeply missed. I know Dr. Fry couldn't be here, but Dr. Davis shared his comments. I would just like to say, as chair, I think we won't have another Tom Borden. There won't be another individual who come through who's going to make that kind of long-lasting contribution to the department. And I'm just proud that I got to know him, albeit briefly. So I'm sure there are others who have more to say. And Mike, do you want to invite the folks to come? I want to thank Mike for all the work you did in putting this together. I want to thank Tony Smith, who wrote that great notice that was distributed. I think he captured, as only Tony can, a lot of the elements of Tom's life. And I particularly want to thank Bernadette for helping to pull everything together. So let me open it to the audience, the family, anyone who would like to make some comments.
I'll go.
Great.
So I worked with Dr. Borden off and on for 23 years. He was a very important person in my life and in my son's life. I don't know, there's not enough words that I can say about my relationship with him. He was my friend, he was my boss. He was always there when I needed him. I got to watch his kids grow up. He got to watch my son grow up, he loved my son a lot. I think at one point he told somebody that he had a spare room and Eric could go live in it, but he didn't know what I was going to do. So that tells you about the love he had for him. A lot of the ladies that I know at work used to call me Mrs. Borden. They said we were more of a married couple type than a boss and an administrative assistant. So I was either called Mrs. Borden or Babs. And I was supposed to walk around with a little dog with my high heels when I'd come to visit everybody. So, but he always knew when there was something bothering me. He would always ask me, and all he had to do was look at me, and I would break down and cry. And then he'd be, "It's going to be okay, Bernie, it'll be okay." Or he would get mad at me, and I would cry, and then I'd get these awesome flowers the next day. And he would say, They always say, sorry, Bernie, love Dr. B. And so that was our relationship. It was really a husband-wife kind of thing. So when I had Eric, I had resigned my position, but I would come every 2 weeks just to come because I wasn't sure if everything was okay. So being a new mom, he'd always tell me Eric was okay and that I was doing a good job. He always asked me every time he saw me, so how's Eric doing? He's doing okay? Do I need to talk to him about anything for you? So he was my strongest supporter at work, or whenever I needed him, he was always there for me. It didn't matter what it was, didn't matter what time of day, he always was there for me. My last conversation with him was at his house the Sunday before he passed away, and he had a nurse there, and her and I were going back and forth about our relationship and telling stories about each other. And so when my time came to leave, I remember leaning over and kissing him on his forehead and telling him, okay, Dr. B, I love you, I'll see you later. And he told me, okay, hon, I love you too. And so that's going to be like the last time that I'll ever hear those words, but they're always engraved in my heart. And yes, my heart is broken. I will miss the many conversations, the hour-long phone calls, the emails. I will miss his smiles, his stories, his laughter, and his hugs. I'm just going to miss everything about him, but he will forever be in my heart. So, thanks.
Thanks so much for having me today. Thanks for inviting me. I'm Roger Lee. I'm the class of 1999. And let me just start by saying that, I really miss New Mexico. Not for the training, blah, 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 not for the good work that's been done, but really for the green chili. I'm in Houston right now, and every time I go out to get green chili, they put the bell pepper on there. It's really embarrassing. I had to cancel about 4 cases. I had my kids, Boy Scout today. I had, it's Chinese New Year, so we have Chinese New Year celebrations. I missed that, but you know what? Who cares? I mean, I wouldn't miss this. I've been pretty lucky to know Dr. Borden and all the staff here, but I've also been unlucky to have known them for such a short time. Not just Dr. Borden, but all my upper level residents here, Dr. Tony Smith, Dr. Ortolano, Dr. Larry Gibble. I see Mike Martinez there also, and I'm sorry, I might be missing a few. But enough said about Dr. Borden being a good person, good mentor, a good surgeon. I mean, I do have some dark side I want to tell you guys also. Okay, but one particular thing where Dr. Borden pauses, where he gathers himself during a difficult case or a difficult conversation, and I actually take that into my operating room right now. Because sometimes when there's a difficult percutaneous case, stone case, radical prostatectomy, when I can't put the ureter back into the bladder correctly, I actually pause. I actually pause for a long time. I stand and I think, and then the operating room immediately know that I'm thinking about something, and they're just on standby getting whatever equipment I need. And usually when I pause for a few minutes or so, automatically I know the case is going to go well, because something is inside there. All the training that I've gotten here, it comes back to me. But anyways, I had a case where I was not a urology resident yet. I was still an intern in general surgery, and I was doing a hypospadias case with Dr. Borden. And you know how he is. He doesn't care where you are. He just grabs stuff. He just grabs instruments. So he moves his hand, and then he does this also. One time I had a pair of Irish scissors right there, then ready to cut. And he reached over, and he just poked his hand, and it was not my fault. It's totally his fault. So I can't repeat what he said, but he said, God beep, Dr. Lee. If this was the beep AIDS patient, I would have gotten the beep HIV virus right now, okay? And he just left the room. So for like 5 minutes, I'm just standing there. Did not know what to do. It's the first time I actually see the penis, the hypospadias thing. But I actually corrected that. Just that same afternoon, we went to the post-op clinic. So we saw some other cases we've done before. And, you know, the penis looks great. The patient had an operation about 4 weeks ago. We took out the catheter. And he would ask me, so Dr. Lee, when do you think she needs to come in? It all depends on how good looking the mom is. So I mean, since like, now that I'm in private practice, no one can hurt me, so I can say whatever I want, right? So Dr. Borden would say, Roger, you know, what do you think? You know, I think I give her an 8, 9 or something like that. Dr. Lee, bring her back in 2 weeks. So if the mom is only like, you know, 2 or 3, that's fine. I think she can follow up next year, that's fine. So anyways, they kept on going on and on, even if, you know, after the penis is totally healed up. I mean, we'll see like a circumcision every 2 weeks for 6 months. Now, the other things that I haven't told anyone else is, you know, once we get stressed out, I get stressed out a little bit. And I don't smoke on a regular basis, only once, you know, like when I party, whatever it is, you know. But y'all know Dr. Borden smokes in his office, right?
Yes.
So he has the humidifier, whatever he got, the air freshener. I actually would go in there. I smoke with him. I pull out a cigarette. I would smoke with him.
Yeah.
So you know, so I think that because I smoke with him, I get the moms back, the good-looking moms back on a timely basis. And I think I scored decent on my in-service, so I think I had to go. So actually, I met my wife in 1998. So we got engaged like 1999. And you know, we're in residency, we didn't have much money, you know. And so actually, I had to ask my wife to marry me on Valentine's Day. Otherwise, I'm going to forget the date. So he actually went with me to the mall to pick out an engagement ring. So you know, I mean, we all had a lot of debts back then, you know. And so, you know, we had bought the loops, right? It's $750 loops, and we couldn't pay it. So I had the choice of, what do I do? He said, well, I still owe you for the loop. And should I pay that, or should I buy a ring, you know? But anyway, the bottom line is he helped me choose a $60 garnet ring as an engagement ring for my wife, so I can pay him back. But anyways, I am, however, upset at one thing about Tom Borden, though. You know, as we were walking out, I remember one day, after something, a difficult case, a difficult clinic or something like that, we were very close. We were very close in going to a strip club. And I think that I would be a resident that can get him there, you know. And we were so close to going there, but he said, no, Roger, when I retire, we'll go, okay? I said, look, Doctor, we can do it. So anyways, Dr. Borden, if I go to heaven, we're going to go party, okay?
I want to thank everybody on behalf of my dad, my sister, and myself. I really appreciate you coming. It's interesting to hear all these stories. I just knew him as Dad. He didn't really bring his work home too much. We didn't know that when he went off dressed dapper every morning that he was going to play Superman that day to a bunch of kids. And as I've gotten older and come across more of his patients and some of the family of his patients, I've heard a lot of nice stories and some funny ones too. It was not uncommon to go out to dinner or something and have a small child come running across the restaurant and tackle my dad, Dr. Borden, and hug on to him. One of the funnier stories I'll share is when I got married at the reception, my father and I needed to get out of the sun. We'd been taking a bunch of pictures in our tuxes, and they're both bright red. And so I said, I'm just going to go off to the restroom. He said, oh, I'll go with you. So we went to the restroom, and there's 3 urinals in there, and in our tuxes. And this Mexican cowboy came in, We were at the Post 13 is the hall where we were holding the reception. And, this guy came in with his big cowboy hat, his big boots, and his big belt buckle, and he said, "You wouldn't happen to be Dr. Borden, would you?" And my dad's, we're both like, "Yeah, why do you ask?" And, he's like, "Well, you worked on my son." And he said, "Oh, well, yeah, what's your son's name?" And he told him, and he said, "How's he doing?" And he said, "He's doing great. He pees like a laser." I nearly made a mess. I was laughing so. When we left the restroom, I said, "Dad, you gotta get business cards made that say, I would like to pee like a laser." So anyway, you folks knew him as a mentor, a colleague, a friend. He was all those things. Master of the pregnant pause. He was also a dad, and I think he was a great dad, so he'll be missed. Thank you.
I'm not good at doing this. Well, most you know, my dad raised me since I was 9 years old, so I give a lot to him. He found out, he helped with my learning disability. I found out I had dyslexia, and he went through a whole bunch of training and found out with my learning, and that helped out with his residency because he's discovered a lot of them also had learning disabilities, so he helped out with that part. So he was my hero. And I miss him very much. And thank you for coming.
I know I've been sitting here hiding in the back, making myself just chilling out in the shadows. My name's Eric Pierce. Bernadette is my mom. I remember Dr. Borden just as this big supporting figure in my life. My dad basically left when I was 2, and he was there for me when my dad wasn't. So he basically, the way my mom described it is just he considered me like another kid that he wanted to just love on. My fondest memory of him that came actually a couple of years back. I'm only 18, so I started driving not too long ago. I remember I got my first truck and I was excited. And I got this phone call from him saying that he wanted to see it. It was a crappy little F-150. I went and I told him that, and he didn't believe me. He told me, he was insistent. He wanted to see what I'm going to be driving around right now. Well, it wasn't exactly me driving it around. But I managed to somehow convince my mother to take it down to the house just so he can check it out. We went out and got him, and I was running out here to get everything ready for him. And he walked out, and the first thing I heard from him, he turned and looked at me. First thing I heard come from his mouth, "Eric, that truck's a piece of crap." What do you expect? I'm sitting there, like, "Told you." So he was a very supportive man throughout my short life so far, and he will be missed ever so dearly. So, thank you.
So, just like to thank everybody for coming out today. I know Dr. Borden obviously is looking down, and he really appreciates seeing you all and laughing a lot.
If I could save time in a bottle, the first thing that I'd like to do is to save every day till eternity passes away, just to spend them with you. If I could make days last forever, if words could make wishes come true, I'd save every day like a treasure and then Again, I would spend them with you. But there never seems to be enough time to do the things you want to do once you find them. I've looked around enough to know that you're the one I want to go through time with. If I had a box just for wishes and dreams that had never come true, the box would be empty except for the memory of how they were answered by you. But there never seems to be enough time to do the things you want to do once you find them. Looked around enough to know that you're the one I want to go through.